Hi, everyone. I'm Sarah with All Things Aging, and I have Danielle with me as well as Allison, who is a thanatologist and the Director of Education and Community Support for Minnesota Hospice. Thank you so much for coming with us today onto the show. We are so honored to have you with us today.
Thank you for having me.
Yes, of course. And then if you wouldn't mind sharing just a little bit about yourself as well.
Well, I am as you said, the Director of Education and Community Support with Minnesota Hospice. I'm also their resident thanatologist. And for those who don't know what a thanatologist is, thanatology is the scientific study of death, dying, bereavement, and loss. And my master's degree and my certification is in thanatology.
Oh my gosh, yeah. I have to admit, when I first heard that, especially working with Allison, she actually trained me in hospice in a prior life. And then when she told me she was a thanatologist, I had to ask, I was like,
What is it?
yeah. Yeah. And then I was like, oh, that makes perfect sense.
Yeah.
Think
Right.
Thanos of the Marvel movies.
Yeah. Yeah. But it was just like,
Yeah.
so yeah, I think it's really good that you explain to people what that is. And it's something that more people should talk about, of course, as you went to school for it.
There's only probably a handful of us in Minnesota at the moment. So
Wow.
Yes.
Wow.
That's certainly impressive.
What made you want to get into that?
honestly, I don't know how I worked in hospice for so many years and didn't know this degree existed. And a shout out to our chaplain, Michael, who said, we really need a thanatologist. And I said, wait, what?
Yeah.
What's that? And he explained, and I went hunting, and I decided that that was what I wanted to be when I grew up.
Yeah, that's so perfect, honestly, especially for you and like what you're into and who you work for with Minnesota Hospice. So that is wonderful.
Yeah. So why don't you explain kind of what hospice care is?
Well, hospice is really a concept of care, and it is a holistic concept of care that encompasses not just an individual, but their entire family, loved ones, caregivers when they are seeking quality of life versus quantity of life, and they have a life limiting illness. And we come into play when that illness would reasonably be expected to end in death in 6 months or less. And the types of things that we provide in hospice, we provide an entire team, we provide equipment and supplies, we provide all medications, we provide physical as well as emotional and spiritual support to the individual and their family and loved ones.
And then that typically, to your point, is covered under Medicare.
100% covered by Medicare, Medicaid, and most private insurances. But just about any hospice that you talk with, if you're dealing with private insurance, are very transparent, and we can help navigate that.
That makes sense.
Yeah.
And then how did you get into the hospice field?
Like many people, by accident. Actually, I started in hospice in my late teens and early 20s. I I was a certified nursing assistant and started working for a hospice, and I didn't really understand it very well. And that was back in the 90s when, hospice has only been around as a benefit since the 80s. It's changed drastically since then. And throughout my career, I've always been kind of death adjacent in some way. So when I had the opportunity to return to hospice over a decade ago now, I jumped at the chance.
Makes sense.
Yeah.
Makes sense. Well, who better than Allison? Of course, I'm going to be. What would you say? And I know that this is a question that I'm sure that you get a lot, but what is the difference between hospice and palliative care for people?
Yes. Hospice and palliative care those terms are often used interchangeably, but there are nuances to it. All hospice is palliative care, but not all palliative care is hospice.
Okay.
So when I say that, palliative care is often used by people who are dealing with a chronic long-term illness or disease process, and they need help managing that long term.
Sure.
So they might be getting some extra counseling support, some extra, pain and symptom management support, and that people can be in palliative care for a very, very long time. And hospice is that last portion of palliative care for end of life. And hospice typically comes to wherever people call home.
Sure.
So whether that's their own home, a friend's home, an assisted living, a skilled nursing facility, wherever they're at and wherever they're comfortable.
That's good.
Yeah. Who qualifies for hospice, and when should families seek out that option?
Thank you for asking that question.
We get a lot of that. It's
Yeah.
like, when should they?
When I talk with families and I talk about the hospice benefit and the types of things that are offered underneath it, a lot of people are like, that sounds awesome. What's the catch?
Right.
And really, the catch is you have to be at end of life. You have to be certified by 2 medical doctors as having a prognosis of 6 months or less. Now that doesn't mean that somebody can't be on for longer, but typically that's the Medicare guidelines. People who qualify for hospice, we're looking at a prognosis of 6 months or less if the disease process is allowed to run its normal course, and who are no longer seeking or have access to want curative treatment, and who are looking for that quality of life over quantity of life. And so there's some big indicators that we are typically looking for, but there are many,
Right.
many indicators. But the big ones are frequent hospitalization, somebody who is in and out of the hospital frequently and going in, being sent home. Significant weight loss. And when we talk about hospice, we're typically looking at the last 6 months, sometimes up to a year. So what's been happening in that last 6 months? What kind of declines have occurred? So weight loss is a huge one, of a weight loss of 10% or more in the last 6 months, frequent falls, frequent hospitalizations, declines in activities of daily living. And what I mean by that are declines in ability to walk, to bathe, to eat, to care for yourself, those everyday things. Those are probably some of the big ones.
Okay.
But there are many, many other guidelines.
Sure. And on that note, what would you say the typical misconceptions are of hospice? Which I know that there's a few.
Yes.
But
There are.
Yes.
There are. I run into a lot of misconceptions about hospice. One of the big ones I get is, well, we can't put mom on hospice. That would mean we're giving up on her. We're giving up hope.
Right.
And I hear that a lot, but it is so opposite of that. Hospice is not about giving up hope. It is about empowering people to redefine hope based on a new reality. And in talking about goals and unfinished business that are important to them at this time of life.
And of course, and to your point too, and taking care of, not to get too ahead of myself, but that whole person and all of their needs, which of course, on that note too, who are the types of people that are working with you in hospice?
The really beautiful thing about the hospice concept is it is truly a team approach. It is all of our teams work together and all of our disciplines work together. So with that interdisciplinary approach, we always are happy to work with people's own medical doctor. People worry about having to give up their doctor, and that is not at all what happens. We love to work with people's primary care provider. In addition to that, we have our medical directors and our doctors. We have nurse practitioners. One thing that's unique about us is we have nurse practitioners that go in and make house calls and help to to admit some of those more complex patients.
Sure.
We also have nursing staff that come in and do those regular visits with people
Mhm.
based on need, anywhere from once or twice a week up to daily. There does come a time where people are seeing our nurses every single day.
Sure.
In addition to that, people have social workers who are there to provide not just counseling support and that emotional support,
Mhm.
but also to help navigate some of those complexities at end of life.
Mhm.
And paperwork. CNAs, all of our home health aides are certified nursing assistants, and they help with things like dressing and bathing and socialization and can make life a little bit easier for
Mhm.
families and caregivers.
Mhm.
Because our whole goal in hospice is to walk alongside people
Mhm.
and to take as much of that stress off of them as possible so they can be the wives, the daughters, the children
Sure.
of their loved one, and
Yeah.
they don't have to spend as much time in that proper caregiving role.
Mhm.
Absolutely.
Makes sense.
Yeah. What about, let's talk about some hospice myths.
Okay,
Yeah, there's lots.
throw 'em at me. I'm ready.
So when I recommend hospice, we recommend hospice. And the one thing is, like you kind of pointed out, well, we don't want to get on hospice. Where does that mean she's going to pass away in a few days? Or talk about that.
There was a really interesting study done a number of years ago by the National Hospice and Palliative Care Organization
Mhm.
about whether or not hospice shortens somebody's life.
Mhm.
And the fascinating thing about it is they found that people on average live 29 days longer on hospice than when they're pursuing life prolonging curative treatment in that end stage.
Mhm.
And do you want to, why, right?
Yeah.
That
Yeah.
doesn't make a whole lot of sense, but it really does. When people have the support system behind them, the equipment and supplies that they need to be as independent and as safe and as functional as possible for as long as possible, and their pain and symptoms are
Yeah.
under control,
Mhm.
those give quality of life and people
Absolutely.
live longer.
Absolutely. Yeah.
And on that note too, and not to interrupt you, in regards to, and I know that you hear it a lot when it comes to, for instance, morphine, because you'll hear, well, morphine, they killed my grandma, for instance, or
Yeah.
something like that, which
So we don't want to see them all
Right.
right up, and
Yep.
get that a lot too.
More opioids are a common are a common fear
Mhm.
for a lot of caregivers and patients. And the thing about end of life is these opioids can be wonder drugs.
Yeah.
Because they not only help to manage pain, they can help to manage breathing and some of that anxiety or air hunger that people might have with shortness of breath at end of
Mhm.
life.
Yeah.
And we're not concerned about addiction. There's a difference between addiction and dependence. And you really need a psychological factor to
Sure.
be playing into addiction. And at end of life, we are concerned about comfort, about
Mhm.
keeping people as comfortable as they want to be. And our whole goal is never to snow somebody.
Sure.
Never. But we're going to be having discussions because
Balance.
it's about balance. It's about
Mhm.
balance
Mhm.
and it's about what each individual wants because everybody has a different idea of what a good death looks like and
Yeah.
what's important to them.
Mhm.
And one person's good death could look very different from another's.
Yeah.
And some people would prefer to have a little pain and be more with it.
Mhm.
And others are like, no, I don't want to feel that pain.
Mhm.
So it's about tailoring care to meet each individual's needs.
Yeah. Yeah. And most hospice is in home settings, but is there any other, you know,
Sure.
anywhere else?
Sure, there are lots of people, lots of places, as I mentioned before, the home settings, assisted living, skilled
Sure.
nursing. There are brick and mortar hospices,
Okay.
but where people can go and be there. But those also entail room and board.
Yeah.
So the services of hospice is covered under Medicare, Medicaid, and most private insurance.
Mhm.
But that room and board people would also be responsible for at that time.
Okay. Okay.
And then is hospice, would you say that just provides medical care, or does that provide like emotional support and spiritual support as well?
And what does that look like?
Yeah.
Sure. Hospice, as I said, is extremely holistic. We look at the whole person. We look at them not just physically, but emotionally, psychologically, and spiritually.
Mhm.
Because people, I mean, emotional and spiritual pain
Mhm.
can be just as painful as physical pain, and it can contribute to physical pain. So it's really, really important that we're looking at the whole individual and addressing all aspects of what they're dealing with at end of life.
Mhm.
Okay. That's nice.
Does someone on hospice have to stop receiving medical care, medical
No,
services?
no.
That's a big one.
That is a big one.
Yeah.
When people are admitted onto hospice, they have a primary diagnosis.
Mhm.
That primary diagnosis is the disease typically that will be put on their death certificate that they are going to die from. But no, we want people to go to the dentist and go to the eye doctor. And if they've got something going on, they can certainly go see their general practitioner.
Mhm.
But the really, really beautiful thing about hospice is our medical care comes to you at home.
Yeah.
So what, yep. So whatever that looks like.
Should stop it.
Mhm.
Patient leave hospice if their condition improves.
Yes. First of all, what I think a lot of people don't understand is even if you choose hospice, number one, you are not stuck there if you do not want to be there. You can always choose to revoke hospice.
Okay.
If there's a new treatment that comes up or you want to pursue, a hospital stay, you can revoke hospice. There are times where people come on to hospice care, they qualify for hospice care when they come on, they get a bunch of support and their pain and symptoms managed, and all of a sudden you just see them blossom
Yeah.
and they start improving. And when that happens, there are times where people can graduate from hospice as well.
Okay.
Nice. Yeah, I think that, I would imagine a lot of people have some relief when you tell them stories like that too,
I mean, it's not the norm. I
Right.
mean, let's
No.
be honest, it's not the norm, but it is possible to graduate from hospice.
Right.
I had a gentleman when I walked in, he was almost transitional. He was barely responding. He was just, he was really,
Close.
really close. And he and his family decided to go on to hospice.
Mhm.
And 3 months later, he's up, he's walking, he's eating,
Isn't that
he's
amazing?
doing
Wow.
all of these things. And he no longer qualified for hospice because he no longer had a 6-month prognosis.
That's great.
So you see these really wonderful stories sometimes.
Yeah. Let's talk about the emotional and practical side of hospice.
Mhm.
So how does hospice help family members and caregivers through the process?
That is, again, why I'm such a huge proponent of hospice. It's
Mhm.
not just about the individual, it is about the whole family and loved ones. And so hospice is there to provide that emotional support, that counseling support, resources
Mhm.
to families and caregivers
Mhm.
who might be needing that.
Yeah.
And also a part of hospice is once your loved one has died, we provide support, bereavement support
Mhm.
for up to 13 months
Wow.
after the death of their loved one. So, you've got that counseling support. There are
Mhm.
groups out there and there are resources there as well.
Yeah, that's really nice.
What would you say are some of like the biggest challenges that families face when it comes to just hospice in general and the emotional aspect?
Making the choice,
Yeah.
making that initial choice that it's time.
Mhm.
I always, when I teach classes, one of the things that I really press is don't wait until you're in crisis to have these conversations.
Right.
Because number one, you have choice in hospice. You don't have to just take the hospice that your doctor throws at you or the hospital might throw at you. You have choices, and there are many great hospices out there. But we all offer the same core services, but we
Mhm.
all offer hospice in a slightly different way with maybe some additional integrative
Sure.
therapies that might not be
Yep.
offered by others. And it's really important, I think, that people learn about this before they're in crisis,
Mhm.
because people fear what they don't understand.
Right. Right.
And you can't make informed decisions without all your information.
Yeah.
And I think a lot of families are reticent about even just sitting down to talk about it.
Mhm.
And if I can have a family and just sit down and talk about it, that's one of the biggest hurdles, is getting over that
Mhm.
misconception of what they think hospice is
Right.
and what hospice actually is.
Mhm.
Right.
Yeah.
Because I mean, I know from experience too, and some families would ask, hey, don't say the word hospice.
Hmm.
Or like make sure you cover up your uniform, for the
Hmm.
nurses when they come in. How do you deal with that, like with families when they're talking about stuff like that? Which obviously delicately, right? But what do you do?
Delicately. And we have to remember that culturally people are different. Different
Yeah.
cultures have different beliefs about end of life and death and dying.
Mhm.
Mhm.
And in some cultures, to talk about somebody's dying is inappropriate,
Sure.
and you're having those conversations with elders or relatives, and so you have to respect the cultural aspects. But one of the things that we also say is, we aren't going to lie about it either.
Right. Right.
Yeah.
We're not
Right.
going to lie about it either if people
Mhm.
ask
Right.
why we're there. But I have had whole hospice conversations without using the word hospice,
Mhm.
because they hear the word and they just shut down.
Yeah. Mhm.
And so I have had whole conversations where I'm like, you know what? I know this is a scary word. We're going to talk about this without ever even using that word,
Sure.
because it's about what is it that hospice does, right?
Mhm.
It
Mhm.
provides that support and everything people need to truly have quality of life at end of life.
Mhm.
Right. Like sometimes I wonder if the phrase or if it was coined as like comfort care, if people would have that same, feelings behind that, which I mean, I would imagine that they would.
And we do use euphemisms, right?
Right.
In the United States, we're renowned for euphemisms about
Yeah.
end of life.
Yeah. Right. Right.
Um,
It's like, oh, you're not comfortable with that word? Okay, well, how about
we'll
comfort
use a
care?
different
Yeah.
word, right?
Yeah.
Yeah.
And words matter.
Yes.
Words also matter, and we want to make sure that we're communicating with people in the ways that they're comfortable with and can hear and understand.
Mhm. Yeah. And you guys, hospice offers a lot of volunteers for families.
Yes,
Kind of
yes.
talk about that. What roles do they?
Well,
What?
Sure. One of the really interesting things about hospice is that Medicare mandates that 5% of our service must be provided by volunteers.
Okay.
So it's one of the only
Mhm.
mandated volunteer programs in a healthcare setting that I'm aware of, because it originally started with volunteers in the 1950s with Dame Cicely Saunders. So volunteers are a key part of what we do.
Yeah.
And volunteers do a wide variety of things. And each hospice utilizes their volunteers in different ways.
Mhm.
But we have volunteers that do social visits, pet companionship visits. They come in and play music. Uh, we have volunteers who do Reiki,
Mhm.
I have a volunteer who helps co-facilitate a group with me.
Mhm.
So her is, a retired nurse and
Right.
therapist.
Yeah.
So we have all of these really wonderful people
Mhm.
with great expertise and backgrounds
Mhm.
who want to be a part of this.
Yeah.
We have vigil volunteers.
Mhm.
So it really depends on the expertise and desires of the volunteer and what's needed by our patients and families.
Okay.
Makes sense.
Yeah.
Can you share a meaningful or memorable experience that you've had with a hospice patient or family that you'd be willing to share with us?
The, well, one of the most meaningful experiences I had was actually the first death I was bedside with.
Mhm.
I
You
we had
always remember that one.
Mhm.
Yeah.
And it was probably one of the most beautiful deaths I've ever experienced. I was sitting with her as she was actively dying, and she had been asleep and not conscious all day long. And I was holding her hand, and she woke up, looked straight over my shoulder, got this huge smile on her face, and she said, "Oh, the angel's here
Oh,
to come get me. It's
Mhm.
time for me to go home." She took one last big deep breath
Mhm.
and died with a smile on her face.
I love those
It
stories.
was one of the most beautiful things I've ever seen.
Mhm.
And that has stuck with me
Mhm.
decades later.
Yeah.
And that's the way it should be.
Yeah,
Mhm.
absolutely. That's so beautiful.
Mhm. Yeah.
I'm not a crier, but
I
I'm like,
know. I know.
on that note too, what do you wish that more people knew about hospice care or would benefit them to know on that note too?
Another fantastic question. One thing I wish families and individuals knew is that people benefit more from hospice the earlier they come on to hospice.
Mhm.
Hospice is not about just the last days or weeks of life.
Mhm.
It can be about the last months of life, which can really improve, that quality of care. It can improve that comfort level for people,
Mhm.
and it allows families to develop relationships with their team, and the team to get to know the family as well, and to help manage that decline to
Mhm.
be more comfortable and maybe less precipitous.
Mhm.
Okay. That makes
Yeah.
sense too. How has working in hospice changed your perspective on life and death? That's a loaded question. I know.
You know, one thing, the biggest thing it has done
Mhm.
is it has made me realize that life is truly short, and do what you want to do now. Make sure that you are telling the people you love them, and healing those relationships now, because these are the things that we regret later.
Right.
And
Right.
it's about living life fully now in every moment of our life. So I'm all about going on that trip now, and
Living your life.
and living your life, and not just in that daily,
Right. Grind.
humdrum.
Yeah.
Yeah.
Yeah. What should families look for when choosing a hospice provider?
Families should ask some really important questions because, as I said before, each family and each individual needs something a little bit different. We really need to tailor our care to meet each individual's needs. It can't be a cookie cutter approach.
Yeah.
So, with that being said, families should be asking the important questions to them. Do I have a consistent team? How often are visits? How do you deal with things like after hours? What kind of integrative therapies do you have? How often will my nurse visit, my aide visit?
Yeah.
Staffing levels.
Yeah.
Pain on the weekends.
Clean on the weekends, yep.
Mhm.
Another thing, what kind of integrative therapies? So if there's an integrative therapy that's really important to you and that hospice doesn't offer it, others might.
Mhm.
So it's really important that you're asking the questions that are important to you, but really you want to know who your team is, if it's going to be consistent, when can we expect, what can we expect?
Yep. Yeah. How can families start a conversation with their loved one about talking about hospice or hospice resources? How does that look?
I think you have to start the conversation. A lot of people avoid
Yeah.
having that conversation. It's not an easy one, is it? But having the courage to just even start the conversation is important.
Yeah.
And sometimes you might get shut down,
Right.
but it just means you circle back around
Planting the
later.
seed.
You plant the seed.
Yeah.
Yep. And if they're open to it, I would encourage people to do some research, get online, check out hospices. We are all graded by the
Yeah.
government. If you go to medicare.gov
Mhm.
and look up the hospice compare website,
Yep.
you can see every hospice in there and how we're graded on everything from pain management to shortness of breath to how we treat families and deal with every aspect of that being.
Yeah.
So you can compare. I know Minnesota Hospice is one of 4 or 5 in in all of Minnesota that's a 5-star rated hospice.
That's so great.
So we're proud of that.
Yeah.
As you should be.
That's awesome.
That is amazing.
Yeah.
On that note, too, what resources do you typically recommend for families that are considering hospice?
I'm sorry, can you say that?
What resources do you recommend to families, or would you recommend to families that are considering hospice?
I would suggest really having a really good talk with your doctor first and in getting a really realistic, understanding of where you are in the disease process. Your healthcare providers can be a huge resource in having those conversations. You can find information on, the area agency on aging. You can Google hospices near me. There are a ton of resources out there, and you can just call a hospice and say, I have questions. And there will be people that are more than happy to sit down and answer those.
Yeah.
Right.
Yeah. Yeah.
Where can listeners go to learn more about hospice services and to get support?
You can again ask your physician, your doctor. If you are living in an assisted living or a skilled nursing facility, you can certainly ask that director of nursing or
Sure.
executive director. Or as I said before, take a look online, take a look at the websites of each hospice, see what each has to offer and give them a call. Every hospice has somebody who is a liaison who can sit down with each family individually and answer questions and understand each family's needs and be able to walk them through that process and make it very, very simple if they so choose. And just having the conversation doesn't mean you're signing on to hospice.
Yeah.
It just means you're gathering information.
Yeah.
And then I was going to ask you too, is there anything with this hospice conversation that we didn't cover that you would like to cover? Is there anything that you can think of? I know, a loaded question again. Yeah.
Just, you know, when you are dealing with a life-limiting illness and you are starting to to look at options, I would strongly suggest having the conversation with a hospice long before you need us.
Mhm.
And so that you can truly think through your options and what's important and what you want, because this is all about giving people back control
Yeah.
and empowering them to truly live their lives in the way they want to.
Mhm.
So look that up, make an appointment, sit down with somebody, have that discussion before you need us.
Yeah.
And remember that that you always have choice. You don't have to choose any hospice, just a certain type of
Right.
hospice. You always, always, always have choice.
Yeah.
I think that's really important for people to know too, to your point.
Mhm.
Absolutely.
Yeah.
Well, thank you so much, Allison. It
Thank
was a
you.
pleasure
Thank you
to
so
have you
much.
on, and we are excited to share this with our listeners as well. And thank you for tuning in. Thanks.
Bye.